Hello, my name is Trina Ganguly, and today I'll be discussing pharmacology and my choice of allied health career. So the allied health professional career specialty I have chosen is a surgical neurophysiologist. I chose this specialty because it seemed like such a niche profession and I had never heard of it. And what really pulled me to thinking about a career in this field was how they deal with neuroanatomy and neurophysiology. And I love learning everything related to the brain and the nervous system. And my two most favorite subjects to learn about are psychiatry and neurology. With this profession, I can have a lot of experience in the medical field since I'll be working in a team of various types of healthcare professionals. And surgical neurophysiology, which is also known as intraoperative neurophysiology monitoring, or IONM, are an integral part of the surgical team and works closely with the anesthesiologist, the anesthetist, the surgeons, and various other members of the team. They perform testing and monitoring of the nervous system during surgery to assess the surgeons in avoiding or reducing any complications such as paralysis, hearing loss, or stroke, depending on the type of surgery, by detecting any incipient injury in time to prevent or ameliorate it. Surgical neurophysiology also provides information to the surgeon for use during intraoperative decision making. And so to be a surgical neurophysiologist, there are some education requirements that are needed. Being a surgical neurophysiologist typically requires a bachelor's degree in a related area or field, and it also requires a master's or doctoral degree in life science, neuroscience, biology, audiology, or any related subject matter, as well as an advanced certification in neurophysiologic intraoperative monitoring from either ABRET Neurodiagnostic Credentialing and Accreditation, or some professionals also can earn the same certification through the American Board of Neurophysiologic Monitoring, which is ABNM, as a means of demonstrating their skills, and or various organizations and academic institutions which offer training programs of varying lengths and complexities in this topic. There are multiple doctoral programs and master's programs out there that are equivalent to getting the certification, because they give you certification during the master's or doctoral program. So those would be one of the various institutions where you could get the education. In addition, in order to succeed in this role, you should be comfortable working in a hospital environment and setting. You also need interpersonal skills and the ability to communicate effectively with both patients and the healthcare experts, especially during the crucial decision-making process when observing what kind of drugs are being used, what surgical procedures are occurring, and imaging methods that may be used. Surgical neurophysiologists work in the hospital, as mentioned before, and in specific the operating room with the anesthesiologist, surgeon, nursing staff, and various other members of a patient's healthcare team. Regarding schedule and working hours, work schedules for every day is different, and these differences are usually due to a number of different factors, such as the monitoring volume of the area or facility in which you are working, the case complexity of the operation, the skill of the surgeon, other coworkers in the area, and etc. Also, regarding salary on Glassdoor, they said that the estimated total pay for a surgical neurophysiologist is $133,000 per year in the United States, with an average salary of 117.5 thousand per year. And they mentioned that an estimated additional pay is about almost 16,000 per year. And this additional pay could include cash bonus, commission, tips, and profit sharing and other methods. However, salary for this position is also heavily dependent in the location where you work. For instance, the salary in Ohio is different from the salary in New York, so depending on where you go, the salary will be different. Sometimes it also depends on the company that you're working for. Salaries do change depending on what company you're going to. And regarding the various scheduling hours are very much dependent upon the workload of that day, how many cases the surgeon is willing to do that day, and it also depends very greatly on the patients that you're seeing and what kind of what kind of a healthcare team that they need and what they need on that healthcare team. And so now we will talk about the job responsibilities. So the majority of this position entails monitoring surgeries. Surgical neurophysiology monitoring employs a wide variety of modalities, each with a very specific application. It is most applicable when there is a specific risk to some part of the nervous system. For some types of surgery, such as cerebellar tumors, there is no suitable monitoring technique. Some of the most commonly monitored surgeries include spinal surgery, certain types of brain surgery, some ENT procedures, peripheral nerve surgery, and vascular surgery, such as carotid endarterectomies and thoracic abdominal aortic aneurysms. Also for this position, they require a knowledge of anatomy, physiology, pathologic processes, and aseptic techniques. They also require knowledge of electrophysiological equipment, which will be used in performing tests on the patients, along with understanding the correct procedures and following them and conducting the tests and examinations for the patients, and the ability to evaluate various electronic and neurophysiologic waveforms. So waveforms will be coming in handy. The knowledge of waveforms will be coming in handy, especially when the surgical neurophysiologist is looking at the different imaging results that correlate with waveforms, and having knowledge on that, you can help with decision-making processes. In addition, a surgical neurophysiologist performs testing and monitoring of the nervous system during surgery to assist the surgeons in avoiding or reducing any complications such as paralysis, hearing loss, or stroke. And so they conduct electroencephalograms, electromyographies, somatosensory evoked potentials, brainstem, auditory evoked potentials, direct nerve testing, and various other modalities intraoperatively. And they communicate these findings to the rest of the operating room team. And so overall, the skills you would need for this position would be communication skills, basic computer skills, computer literacy skills, the ability to adapt and thrive in a very high stress environment when necessary, and work well in a team or independent. And some other skills that are required for this position would be skills on understanding the different modalities and how to use them, such as SSEP, which is somatosensory evoked potentials, EMG, electromyography, and TCE MEP, which is transcranial electrical motor evoked potentials, among various of many others. The career choice, this career choice has a very close relationship to pharmacology and understanding the systems of the body. Surgical physiologists directly work with the nervous system, and in specific the brain and the spinal cord. They work in the field of intraoperative neuromonitoring, which is IONM. And so IONM protocol strongly advocates the use of total intravenous anesthesia for patients who undergo any kind of neurosurgical or spinal surgeries using IONM, particularly if TCMEP monitoring is planned. Propofol and remifentanil are the most common drugs used during TIVA, and neuromuscular blockers are avoided if the IONM involves EMG or TCMEP. But short-acting neuromuscular blockers are acceptable for intubation during those monitoring processes. Neuromuscular or TOF monitoring is used to ensure the patient has 4 out of 4 twitches before commencing any kind of IONM monitoring and surgery. It is for these reasons that it's imperative that the surgical neurophysiologists have knowledge and experience with pharmacology and the various body systems that they will be working with. And being a part of a team, they will be expected to pitch in and make collaborative decisions regarding the crucial decision-making process for the patient's experience and their care while they're at the hospital. And so now I'll talk about some of my research reflections. My original idea for this field was that they would need a medical degree most probably, since it has to do with surgery and being in an OR and neurophysiology. Either a medical degree or a nursing degree or something of that sort. Also, when I saw this career prospect, I never knew it was something or that it even existed, so I didn't really know what to expect when I first heard about it. And the thing that surprised me the most was that after doing my research on the topic, I'm actually so interested in working in this area. I usually don't like working with or thinking about working in areas of surgeries, because my impression was anyone who works in the operative room has to be a part of the physical operation process itself, and I would much rather be there I would much rather talk to the patient and have more of a relationship through that way. That's why I'm a big fan of psychiatry. But after reading more on the surgical neurophysiology field, I feel more comfortable and open with the aspect of working in an OR, since there's so many other things that go on besides just the physical surgery. And so when it comes to comparing my ideas when I initially started this project to now when I'm ending it, a lot of what I learned was new and eye-opening to what all goes on in the OR, and how there's so much that goes into being part of a patient's healthcare team, and also during the process of a surgery, whether it's during the surgery, before the surgery, or after. There is a lot that goes into it. And here are my references that I used for my presentation. Thank you for listening. Bye.